Ida Nanos is a nurse at Kawempe Home Care, whose day begins with some exercise. Prayers soon follow. She calls for divine intervention to enable her go through the difficult tasks she carries out almost daily. All the healthcare workers in this circle need these prayers. Ida heads off to the store to collect the day's medical supplies with assurance of having a blessed day. She's going on patient home visits.
We can visit like 4 patients, so we have to pack everything we are going to use in the field.
When all is packed, she goes with a crew that includes the executive director of the home care, Dr. Samuel Guma. The doctor says that sometimes they get to visit about 8 patients daily. The kind of patients they visit are those who have mostly been abandoned by their relatives for having life-threatening illnesses. Such conditions require palliative care, a field that Ida has mastered.
Since I started working with Kawempe Home Care, that's where I was introduced to palliative care, and I got a chance to go for a training with Hospice Africa. So I got skills, and I saw it was important for our patients because we also work on the terminally ill patients.
The day's first patient is in the Kasangati area. We tagged along to see how they treat her in an effort to understand what palliative care is all about.
It has gone out of urban area to up-country areas, and through training, it has created self-awareness among people.
Ida, together with a community volunteer, changed into protective clothing and began attending to an AIDS patient.
I've been caring for her for almost 4 months now. Actually, when we came in, she was in a lot of pain because the sores had kind of eaten up all the tissues around the buttocks area and the legs, and that causes so much pain.
But I fear. Naye olw'okubanga twali twasomesebwa n'enguma.
According to the World Health Organization, about 1/3 of those needing palliative care suffer from cancer. Others have progressive illnesses affecting their heart, lung, liver, kidney, brain, or life-threatening diseases including HIV and drug-resistant tuberculosis. Their pain can be reduced with treatment and their symptoms made milder.
And we also not only provide care for the medical aspect, but we also look into psychosocial issues, spiritual issues, and also emotional issues.
Home-based care, I would say, is the ideal for our patients, honestly. Because when you look at Uganda, most of our patients are so poor, they cannot get to health facilities. So if home-based care can reach all the patients who need it, it will be very, very good.
Rose Chwanuka is the first Ugandan palliative care nurse working with the Palliative Care Association of Uganda, PCAU. She says it has been a long journey since 1993, when PC was first introduced in the country by Hospice Africa by a British doctor called Anne Merriman.
However, people are getting so busy in that they are forgetting to care for their own colleagues. For instance, you may go into a village and you find that there is somebody in an isolated area suffering alone in the house.
Partnerships among organizations like the Infectious Diseases, CDC, Hope for Children International, and the Ministry of Health have been credited for helping provide this human rights service. In the first ever Global Atlas of Palliative Care at the End of Life, published by the WHO and the Worldwide Palliative Care Alliance, only 1 in 10 people who need palliative care is receiving it. The unmet need is big, and according to the World Hospice and Palliative Care Alliance, about 18 million people die in pain and distress annually. This ailing 7-year-old boy, whom we shall call Joshua, bears a lot of pain. NTV aired a report in 2013 that showed 2 patients co-infected with cancer and HIV. They were receiving palliative care. We've learned that they passed on in a less painful and dignified way, unlike other patients who are not taken through this care and treatment regimen.
Sometimes it's certain that somebody is going to pass on, regardless of what we do. But really, our focus is to give them a peaceful end.
Uganda is trying to scale up services, though many districts are yet to be covered. However, it is the only African country out of 20 globally that have palliative care integrated in the healthcare system. Some of the other countries include France, the US, and Germany. Florence Salimba, NTV.